Hello everyone, Drew Watts here, the Business Development Manager for Restorative Oxygen Care, back with our Medical Director, Dr. James Collier.
Hello.
And our topic of conversation today is going to be compromised skin grafts and flaps. And that's another indication or condition that is approved, right?
That is
for the use of hyperbaric oxygen therapy. So what might happen for a patient to come to us with a compromised skin graft or flap?
Okay. I think most people understand what a skin graft is. That is tissue that has been moved from one place to another to enhance performance of a body area, sometimes simply for beautification. The other thing is what are called flaps. Flaps are typically done to close big wounds, often associated with a surgical procedure. When we're looking at the more elective procedures, generally you start with tissue that is in good health to begin with. When you're talking about surgical wounds, often you have had to do surgery through skin that was not very healthy. What happens is blood flow is disrupted or altered in the process of flapping or grafting, making it difficult for the normal amount of blood to be in those tissues. Our job with hyperbaric is to get more oxygen into those tissues that are ailing but salvageable, because we want to save them. We want to preserve the graft, we want to preserve the flap. Adding more oxygen is quite helpful with that.
Right. And so what about infection? How is, obviously there can sometimes be an infection component.
Yes, sometimes the skin has been compromised to begin with because it's been sliced open in some fashion. That is an opportunity for germs to appear. They will help compromise the tissue, and hyperbaric helps suppress the germs.
Fantastic. And so I would assume or imagine that using hyperbarics kind of ahead of time could help prepare tissues, right, if they were going to be used as a graft?
That is sometimes done, yes.
Okay.
There are certain instances in which insurance companies will approve that. Sometimes that's a bit of a chore, but if we have an opportunity, for instance, we know that we have a tissue that is injured, like say by radiation, that if we do the hyperbaric before the surgery, we can make the tissue stronger so it has a greater chance of healing if it has been flapped or grafted.
That's amazing. Well, again, I think that this technology is incredible. The things that it can do to help outcomes for various different conditions is quite remarkable. And that's one of our goals here with Restorative Oxygen Care, is to be able to grow the technology and expand its approval and use to help patient outcomes and improve access to care for patients. So again, Dr. Collier, I'll let you get back to work. Thank you so much for your time today.
Thank you.
If you have any questions about a compromised skin graft or flap, please give us a call at the phone number listed below, or you can find out more information on our website. Thank you so much.